talked about gallbladder 1, stomach 5, stomach 9, stomach 10, large intestine 18. Depending on where you choose to strike, lung 1 and 2 in the crease of the shoulder. You've got the pericardium and stomach meridians coming in here. You come large intestine 14, gallbladder 24 on the crest of the ribs. Large intestine 14 here, gallbladder 24 here. Gallbladder 26 on the side. Okay. Going on to the arm. This is slightly different. Okay. We're not going for a specific acupuncture point in this technique. What I am going to do, okay, just release leave up. What I'm going to do is look at the inside of the arm here. Okay. Now, if I were to say, grab that skin, everybody go and grab a big lump of skin like this, okay? And that's not what we want. You're grabbing muscle tissue and everything. I'm now just concerned with training that grip that we talked about earlier. If I was manipulating Gary's arm for an arm bar or whatever, or I've got it here, or if you're into law enforcement or door security or anything like that, and you're doing escorting somebody out, okay? And there we're resistant. If you were to grab the skin tissue here, but using the training that you've done, okay, from here, okay, so let's say Gary's resistant, and I pull here, it'll put him straight down to the floor, okay? What I'm doing there is, do you remember the Phoenix Eye Fist we talked about earlier? We're actually going to do the same formation, the same clawing technique, but if you think, instead of curling this way and grabbing this tissue here, what I'm actually doing is I'm doing this, I'm doing this, I'm doing this. And what basically is happening is, instead of using it as a fist to strike, I'm actually using this and this to grip the skin. So it's very focused, very localized. So instead of being this way, I'm actually gripping here. So I'm pressing with the tip of my finger. And remember what we said about tips of fingers. Rather than the pads, go straight for the tip. It's a lot more effective, and you're straight on the bone rather than the pad, which is the soft tissue of your finger. You press down straight onto that mid-knuckle of your thumb, you're straight on bone. So basically, you're squeezing the skin, which is the sensitive area, particularly on the yin surfaces, the inside of his arm, against two bony surfaces. You might as well just get the arm, stick it in a clamp, tighten the clamp up as tight as you can. It's just going to feel exactly the same. It's going to be very, very effective, as you saw. On the inside of the arm, you're just going for the soft tissue. The outside of the arm, from an acupuncture point of view, the yang meridians, they're your armor plating, okay? The inside of your arm are your yin meridians, the ones that tend to be a little bit more sensitive. So you're grabbing, just roll the sleeve up again, you're grabbing. So remember that formation of the Phoenix Eye Fist. So if I do it slow, it's here. I could grab some more skin if I wanted to with this, but this is here, base knuckle of the thumb. Get that tip and squeeze between the two. So that is just those two alone, but I'm forming the proper fist so I get a proper tight grip. Then it's directional. Not that I'm necessarily going to do it, but if I push toward him, see how he comes up on his toe? He lifts. If I come toward me, which is what I want to do, he'll go exactly where I want him to go. Okay? Again, similar to the point on the hip, this will bruise. And again, when I say it bruises, I mean it really bruises. I've done this to people before, in training, and you've had a bruise all across the arm here. So it's one to be careful of with your training partner. That's what I'm trying to say. All right? But it doesn't mean to say you can't make it work, because again, Gary might have a little bit of reddening, and possibly a small bruising may come out, but what I am doing is just showing you how effective that is. Yep? So one more time, okay? Okay, one more time. I'm controlling Gary from a security point of view. I pick that point up, remember, like a Phoenix Eye Fist. I touch it, I pull, see the reaction straight away, and then you would follow through with whatever technique you want to do. But that's how to utilize those points and use that Phoenix Eye Fist in a slightly different, more innovative way, rather than just striking.